Welcome back, everyone. My name is Sandeep Singh. Before I begin today, I would like to ask you all a question. How many of you have seen or heard of a news report like this recently? Just a quick show of hands. Oh, wow. Okay, a lot of you. Since the declaration of the public health emergency in 2016, the toxic drug crisis has claimed the lives of almost 15,000 people across British Columbia. This isn't just a shocking statistic. It's a harsh reality that's affecting families, communities, and individuals every single day. Unregulated drug toxicity still remains the leading cause of death for people in BC aged 10 to 59 and accounts for more deaths than homicides, suicides, accidents, and natural diseases combined. So what if I told you that these numbers don't tell you the full story, especially among marginalized communities, particularly the South Asian community, the community that I come from? This crisis isn't just a drug crisis. It's a crisis of neglect by systems that were never built with these communities in mind. In 2019, the Fraser Health Authority released this report, the Chief Medical Officer's Health Report, which outlined that the South Asian community was disproportionately impacted by the toxic drug crisis. And they noted that 255% increase in overdoses among South Asians, which is nearly a twofold increase compared to non-South Asian people in the Fraser Health region. However, this data is almost 7 years old now and was only calculated using name-based algorithms that estimated ethnicity based on people's names and only provides a rough estimate of the impact of the crisis on the South Asian community. Just as I mentioned, it's a 7-year-old report that doesn't reflect the realities of the crisis today. Additionally, stigma and shame in the community make it even harder for many people that are struggling with the drug crisis and for their stories to be heard. This stigma often arises from a multitude of factors in our communities, where our communities have faced struggles of colonialism and having to navigate challenges in systems that were never designed for them in mind. But today, I hope to change that. I hope to change that by telling you a story of an individual who not only transformed his own life, but continues to transform the lives of many others. As we discuss the theme of metamorphosis today, this story is a truly inspiring story. This is a story of Pravinder Singh, who's actually pictured in the middle, and he's here in the audience with us today because he believes, like I do, that stories like his deserve to be heard. Pravinder Singh came to Canada in 2017. And at the age of 21, he was someone who had never touched a substance before in his life. A son to a mother who had sent him to Canada in hopes to pursue a better education, once a personal trainer who enjoyed going to the gym and even enjoyed doing artwork. But as soon as he arrived in Canada, he had found out that he had been a victim of immigration fraud. His immigration consultant had lied to him about the cost to his education, and facing these financial barriers, along with the stresses that come with being new immigrant to Canada, he would now look for ways to cope. At that time, he lived with roommates who already consumed a variety of drugs, such as alcohol and marijuana, and he too would give that a try. Initially, he started smoking cigarettes, eventually alcohol, and then he would move on to marijuana. But one day, a roommate of his, who he thought was a friend, would introduce him to this new drug, fentanyl. At that time, he did not know this was fentanyl, but his friend had told him that it would help him relieve some of the stress that he was having and some of the pain that he was having. Unknowingly, he would take the drug, but fentanyl, as many of you may have already heard of it because it's very prevalent in BC and in Canada, is a highly potent synthetic drug that's almost 100 times stronger than other opioids like morphine and heroin. And it accounts for almost 80% of the overdoses that are happening across Canada. Just after a few months of using this drug, he would use this daily now, and eventually he would not use for a single day, but then his body would have severe withdrawal symptoms. Facing these withdrawals, he tried to figure out what was happening to him. His roommate and him did a quick Google search, looked at what was this drug, and initially they found out that it was fentanyl. But by then, it was way too late. And fentanyl is a drug that once you continue to take it, you become addicted. It's really hard to get off of it. Quitting fentanyl requires not just medication, but it requires support beyond what he was able to access when he was doing these drugs. Eventually, his addiction would lead him to drop out of college, quitting his job, and losing his immigration status. Losing this immigration status meant that he was not able to work, have a home, and he eventually ended up homeless on the streets of downtown East Side, where he would now spend the next 3 years of his life. But his desire to quit would eventually bring him to the St. Paul's Hospital's Rapid Access and Addiction Care Clinic, where his social worker recognized that he was a man of South Asian descent, a Punjabi man, and he would connect him to this organization called SOUDA. He handed him this flyer, which is pictured above here, and he told him to go to Surrey, where he could potentially get some help. SOUDA, which stands for Students Overcoming Substance Use Disorder and Addiction Society of Canada, is a grassroots nonprofit that was founded in response to this disproportionate impact of the toxic drug crisis on the South Asian community. SOUDA, which comes from the Punjabi word Soud or Sodana, which loosely translates to fix or to improve or to make change. And this is closely tied to our mission of ending the stigma around addiction in our community by building capacity through a community outreach model. SOUDA has pioneered this harm reduction trainings, such as naloxone training in Punjabi, Hindi, and English, where we go to places such as gurdwaras, which is a place of worship for Sikhs, and other community centers to directly interact with individuals in this vulnerable population to teach them these valuable skills. In addition to this, we connect individuals like Parvinder and other families with mental health and substance use services. That day when Parvinder came to us, that was the first time I had seen an individual in a condition that I've never seen another individual in. He was homeless. He had no access to housing, no basic needs, no cell phone to communicate with his family, and he was truly struggling and on the fringes. Our team and our founder, which is pictured here, Gurpreet Singh, would now work with various community organizations, including the Gurdwara, to try to connect Parvinder with resources so he could live a life with dignity. We worked with the Gurdwara to have him so he could have access to regular meals. We were able to find a counselor from the community who would take on giving him free counseling sessions in his own language, because language often plays a big role in recovery and also is often a barrier for many people in accessing these services. This counselor from Moving Forward Family Services would take on these counseling sessions free of charge and would help him on his path to recovery. Additionally, we would help him find housing where members of our team would out of pocket pay for his expenses so he could actually be taken care of and attend his appointments on time and have that transportation so he could be closer to the clinic that he was now at, the Roshni Clinic, which is in Surrey. What we saw with Parvinder was truly unique. After being provided these social supports, we saw an individual who was struggling with the severest of addictions, now overcoming that. He would now stick to his recovery, although he had been in recovery almost 20 times before that. Now he was having positive outcomes in recovery and being in recovery long-term. Inspired by the work that we did for him and for the work that we were doing in the community, Parvinder would now join our team. He joined our team as a peer support worker. As you can see from this picture, Parvinder, who's pictured in the middle with our founder on the left, Gurpreet Singh, this is a picture from 6 months after he has already been in recovery, where he is leading the same trainings that he once saw us lead. And he's now sharing these same valuable resources with the community and providing these trainings and sharing his own story to inspire countless other individuals. Today, Parvinder is almost 2 years sober, but his story doesn't end there. He continues to inspire countless others, and he's been a valuable part of our team, where he's now continuing to lead workshops and various seminars, where he's sharing his story not just with one individual of just one age group. He's sharing these stories with people of all ages. And as you can see from this picture, this is a workshop that he led with high school youth. He also now has a social media channel where he's helping to break the stigma around addiction by sharing his story with almost 7,000 followers and through Instagram Reels and various other platforms. This is the first time we're seeing an individual who is empowered by just a group of university students now creating this level of change that we've never seen in our community. In addition to this, Parvinder now works as a peer with lived experience for various research projects, like the Project Rahi. This is a research project by Dr. Natasha Puri and the team at Roshni Clinic, where he once received care, and they're helping to develop culturally sensitive aftercare programs for people that are South Asian men that are in recovery. In addition to this, he's now a facilitator and a sober speaker, as he calls himself, at the Vapsi Recovery House. Vapsi, which is a local program that was developed by previous users and by Mulkeet Singh and a few others, where he's helping people that are currently in recovery go through their own recovery process. At Vapsi, I actually interviewed 2 of the clients that are currently in recovery there. And this is what they had to say about what Parvinder is doing for them and how their recovery process is going. They shared that Parvinder knows what's going to exactly happen with them because he's been through it. He's lived through it. They shared that stigma prevented them from ever reaching out, and they had no clue how to get help. But another participant, who's a South Asian man, that's a Punjabi man that's born in Canada, was caught up in a lifestyle, and he spent almost 10 years in gangs. But now he talks about how Parvinder has brought him back to the Sikh faith, which often plays an important role in the recovery of countless individuals. He talks about how Parvinder is guiding him through every single step, and he's now 30 days sober as of last week, and how his reconnection to community and Sikhi, which also worked for Parvinder, has helped him heal and stay in recovery. Parvinder's journey isn't just a journey of an individual. It's a journey, it's a lesson for public health and for us in the healthcare system. It teaches us that when we listen to the ones that are the most vulnerable and we treat them with the empathy and we look beyond their drug use, we can truly make change. These two pictures show Pravinder when he first arrived versus now, where he's now working at the Vapsi Recovery House, and he's part of the recovery process of countless other individuals. So when stories like Pravinder's come forward, what is it that we need to do? We've talked a lot about data today, and I mentioned that data often doesn't reflect the realities of the crisis. So firstly, we need to advocate for data, better accurate disaggregated data on these populations that are differentially impacted by the toxic drug crisis. But ultimately, we need to recognize lived experiences like Pravinder's as expertise and involve people who use or have used drugs in the development of these policies and programs so they can truly be culturally sensitive and reflect the cultural identities and the different languages and the different people that need these services, with the goal of breaking down stigma and rebuilding trust among these vulnerable populations. To end, I would like to leave you all with this quote that I once read at a museum in Abbotsford. This is a quote by Muriel Rukeyser in her book, The Speed of Darkness. She says that the universe is made of stories, not of atoms. Today's theme has been about storytelling, about transformation, about change. So I urge you all to look at the stories of the most vulnerable people around you, the stories like Pravinder's, the stories that can help us inspire change, not just at the individual level, but at the community level. It's these stories that can help us create communities that are healthier and stronger. So join me in creating a future where experiences like Pravinder's aren't just stories that are just heard, but they have a chance to take lead. Thank you.